Good morning, everyone. Chuck Melindy with Disruptive Dialogue. President Trump came out and look, guy's trying to do something. And he says, I'm going to give Americans $2,000 to help pay for insurance. My problem with that is we're just throwing more money at the insurers. And look, I did some simple math. Think about this. We're also worried about our freaking deficit. So the U.S. population is 340 million people. Now, let's say he goes, okay, not the wealthy, and not children, just adults. So that's 73% of the population. That would give us 224 million people times $2,000 a person. That's $447 billion going to our deficit, going straight to these companies. We've got the deficit going up. We've got our legislators just throwing money at a problem without a fix. If they want to fix this, and they could pass this in the first quarter of next year, is first off, they tell insurers, you cannot raise your premiums and deductibles faster than the rate of inflation. End of story, period. If not, fine. You don't get to participate in Medicare Advantage. You don't get to participate in Medicaid. You don't get to participate in the VA/DoD. You don't get to participate in the employer marketplace. I mean, we already know that Medicare Advantage is now costing the taxpayers 20% more per beneficiary than Medicare. So throw out the window that the private marketplace is doing better. Look, at the end of the day, they have taken advantage. Everybody in the healthcare system, hospitals, drug manufacturers, device manufacturers, health insurance, pharmacy benefit managers, you name it. They have taken advantage of the capitalist system. They are not regulated. We need to reel them in. We need to take care of the American people. Healthcare has become a tax. If they want to participate in the American system for healthcare, there's going to be some new rules. We need to take care of the American people. We need to start to say you can't raise your increases faster than the cost of inflation. We're not going to let you put up all new guardrails so that then you can not provide services, or you just don't participate. We'll kick them out. That's fine. But this experiment with Medicare Advantage and health insurance, it's not working. So stop throwing money at the problem. Both parties, Dems and Republicans, know this is an issue. The president knows it's an issue. Knock it out in the first quarter next year. And guess what? I'm going to even say, yeah, you can't raise your prices, but we're going to retro back a couple years because the last 3 years I saw a 20% increase in our healthcare costs from insurers. So we're going to retro back 3 years as well. This is what happens when you get greedy. Guess what? Pigs get to eat, hogs get slaughtered. Let's make a difference.